Thank you for joining us. As you know, today we started a kidney week in Rwanda, which will be ended on 30th March with the celebration of International Kidney Day. Today we are very honored to be joined by Dr. Darlene Nyenyeri, who is physician and nephrologist. She's going to be talking to us more a lot about kidney health this kidney week in Rwanda, and we will be going deeper and trying to understand what kidney health is. Thank you so much for joining us.
Thank you for the invitation.
Thank you, Dr. Darlene. First of all, would you please introduce yourself and tell us a lot about your work with kidney health?
Thank you so much. So, as you introduced me, I'm Dr. Nyenyeri Darlene. I'm an adult physician and nephrologist, adult nephrologist. And so I work in two referral hospitals, Rwanda Military Hospital and the King Faisal Hospital. So in those two hospitals, I focused on nephrology, so kidney disease, and mainly at King Faisal, I focus on kidney transplantation.
Thank you so much. In simple terms, what are kidneys? Are they found? How do they work? Help us to understand that.
Simply, it's a big it's a bit complicated because, but I will try. So kidneys, we have two kidneys. First of all, they are located at the back, what we call retroperitoneum, just under the ribs. So those two organs, they're tiny, but they do a lot of work. For maybe I can list all of them, but I will try to go through the main ones. So the first one is they extract what we call metabolic waste. So when we eat, there are some waste that is produced by our organ and is extracted by the kidneys through the urine. The second main one is to also regulate the fluid. So we drink, and even in the food that we take, there is also water. So also the kidneys are in the main function they have is to regulate the fluid. So you mean if I take such amount of fluid, it knows how amount of urine it will produce, so that you doesn't get either dehydrated or overloaded. There's also electrolyte and acid base. There's also hormones that is regulated with the kidneys. There's also the bone. Bone also mainly the calcium and phosphorus, which is also regulated by the kidneys. A lot of things.
Yeah. So as you are explaining to us, I understand that whenever those kidneys are not working well, there are diseases that may come up. So what are the most common diseases people suffer either in Rwanda or internationally? What are those diseases, and what are the signs we should be more careful with? Like the alarming one, like when I have these signs, I know I have to go for a checkup.
Okay. So thank you for the question. So worldwide and even in Rwanda, the most common cause of kidney disease are diabetes mellitus and also hypertension. So we have also a small group of young population who have also other what we call native kidney disease. But this is a small group, as I'm saying. So, but the biggest number is diabetes and hypertension, and it's like worldwide also. That's the trend. And so I would say for the symptoms, sometimes and most of the time it's tricky because most of the kidney disease doesn't give pain, so it doesn't hurt, and many of the signs and symptoms will come late. They present late when your kidneys are starting to suffer a lot. So the symptoms that people might see are like being swelling so of the body, can be the face, can be the limbs. They can present in the urine the change of color. It can also either can become more red, or you can have some what we call frothy. So you see like mousse in the urine. You can also present indirectly some the sign of other disease that cause kidney disease. Let's say you have hypertension. So people with hypertension will come with either with headache, they come with blurry vision. So kidney disease at itself, it's not a painful disease, and it gives symptoms late in stage. I mean, when the stages of kidney disease are very advanced, that's when they present with a. So that's why it can become very tricky to tell someone that you will see this sign and this sign. We don't want them to come when they have sign, because most of the time it's late for us.
So, like in our daily life, like in our daily routine, what are things we can do daily to keep our kidneys healthy, to protect, to prevent for, so that we don't get those diseases?
Yes. So that's a perfect one. So there are golden rules to prevent kidney disease, and they are very easy. It's things that we usually also tell patients, even not kidney disease patients, to do to keep your health in good shape. So the first one is to for the kidneys, which is more specific, is to keep you hydrated. So you have to drink well, between two and 2.5 liters per day, mainly in countries where you have, temperatures can go high. Second is to check, as I said, diabetes and hypertension comes first. You have to check your blood pressure, your blood sugar. You have to do physical activities. You have to eat healthy, healthy. And whenever you have maybe a history of kidney disease, or you're at high risk when you are diabetes and hypertensive, you have also to do regular checkup to see if your kidneys are well functioning. Yes.
Thank you. Like when you talk about regular checkups, it brings me to the question of how is kidney treatment in Rwanda is right now? What are things you celebrate? You say like here we have achieved a lot in kidney treatment. Is it easy for everyone to access kidney treatment?
So I would say we are very happy and very, very proud that in the last years we have, we have reached a very good milestone in kidney treatment. So prevention-wise, if we start by there with hypertension and diabetes, which are the major causes of kidney disease, it's being treated from health center up to the referral hospital. So people can access to medication, and the biggest milestone is what two types of what we call renal replacement therapy, which is one is hemodialysis, which is now covered since last year with CBHI, which covers a lot of more than 80% of the population, and also kidney transplantation, which is also covered by the CBHI. So we have, if I can say, the two main renal replacement therapy. So whenever your kidneys are not functioning anymore, we can get treatment. And it's covered by the insurance, which covers most of the population.
One of the things you talked about, it's about transplants. And when we come to that point, many people has different questions. Like different views about transplants. Most of them are true and others are false, of course. Would you help us understand how transplant is done? So is it done when someone, like the donor, is still alive, or when they are no longer alive? Like help us understand how transplant is done, and tell us all the true things about transplant and things people should know about transplant.
Thank you.
kidney transplants.
Yes. So we are, since May 2023, we are conducting regularly kidney transplantation here in Rwanda. So I will maybe start with the patient, the ones who are sick, the way we process. So they are usually, so we evaluate them in different steps, and we see if they can be candidate for kidney transplantation. So when we say yes, he's a candidate for kidney transplantation, so the patient has to find a donor. So what we are doing here is what we call living donor kidney transplantation, which means the donor is alive. He's a healthy person who comes to donate his kidney. Another type that we are not yet having here in place, which is a deceased donor. So when in that case, we take a deceased donor organ and we give it to a patient. So I will focus on living donor transplantation. So the donor has to be brought by the patient. So we evaluate them in parallel, and they have to go through different steps: psychology evaluation, medical evaluation, surgical evaluation, and they have to go also through legal to see if there is no trafficking. So through RIP, through a national transplant committee who approves them, and then we can proceed for the transplantation. So coming back to the donors, so donors, we evaluate them thoroughly and also meticulously to see if they don't have any contraindication, if they're not at a risk also to get kidney disease in the future. So to have a really kidney donation, which is the most safe we can have. So I get also this opportunity to bring awareness to people that kidney donation is a safe procedure, and people get. I know people, there are some assumption that they will not get back to work, they will not get kids. So those are very false assumptions that they have. And we have also a pool of donors around 90 that are doing well. They are back to work. They have a normal life that they can even share their experience.
I get it now, and if I'm not mistaken, you are among the leaders of Rwanda Renal Organization here. That's a good thing, and I wanted to ask you about Rwanda Renal Organization. How does it work? What's its mission? How does it work with RBC and Ministry of Health in Rwanda? Tell us more about Rwanda Renal Organization and how it collaborates with RBC and Mini Health.
Thank you. So the Rwanda Renal Organization started like 7 years ago. Back there were very few nephrologists compared to now, but we got RGB approval last year in May 2025. So we work, hands to hands with RBC and MOH, because our main mission is to raise awareness about kidney disease, to strengthen the capacity building of the health professionals, and also try to more focus also on prevention, because if I say we have the so the renal replacement therapy is very costly. So we want to focus on preventive measures, so we don't get many patients on hemodialysis or transplantation. It's good that we have them, because we know even if we try our best, we will have some patients who will need hemodialysis or transplantation, but we want to prevent that many patients reaches that stage. So, and also well-being of our members. Yeah, that's the main focus.
That's really a good vision and mission of Rwanda Renal Organization. And as you said, you started when there were still few doctors in the field of nephrology, and I wanted to. And yesterday we celebrated International Women's Day, and that is so inspiring that among those few doctors, we have one who is a woman. And I would like to ask you, like, what inspired you to join kidney healthcare, and how was your journey? Like, briefly, how was your journey? What were those challenges and how you overcame them? Because out there are still young women who want to join kidney healthcare. Like, what can you tell them?
So we are two female nephrologists, and we have also one of our colleagues comes from Ethiopia, but she works also with us here. So my journey. I think I did my med school and my residency program here in Rwanda, and I got inspired when I was doing internal medicine residency in my second year. I'm not saying if I had one click like that, but I really got intrigued with the kidney function and how the things that the kidneys manage to do. It's very complex. It's very crucial for the organ, and I wanted to study more. And I think I think it was inspired one of my professors for nephrology came here, and so I wanted to do more. So that's why I pursued to do nephrology after my internal medicine residency. So nephrology, as a nephrologist, maybe I might be biased, but it's a very good field because we have, yes, a lot of patients, and you can change someone's life. So you can see things. I mean, you can see result of or product of things that you have done for your patient. So you follow your patient. You see them growing, and also your treatment changing their lives, becoming more more independent, having better quality of life. So I usually, even in my practice, really encourage doctors and especially female to join our mission and program. And I really hope that I will do so. I will have more candidates.
Yes, those who are following us, they will be inspired. That is so inspiring. Having like being a woman and jumping into something that there are no other women there, and you could overcome all those challenges to be a nephrologist right now. That is so inspiring. So let's come back to Kidney Week. Let's come back to Kidney Week as it begins, because it started today. What are the activities planned, and what message would you like to share to the public, to the health care professionals? What message would you like? I mean, you start with the activities you are preparing in this week.
So for this week, we have different activities. So we are mostly in these 3 days targeting health professionals. So to make them aware about kidney transplantation, every question around they have, we can answer them, and then so they can also go and spread the news. So even because we feel like even the health professionals sometimes they are scared about kidney transplantation, even donation. So that's first step. On Thursday, we'll have an international webinar with international speakers who will also tackle around kidney transplantation in Rwanda, what we have achieved, challenges, and also we'll have a special topic about pediatric transplantation, which is a small population for us, but it matters a lot because transplantation in pediatrics can change a life, can change a family trajectory. And on Friday, we will end up with a symposium with all our stakeholders that work with us in transplantation and nephrology, and we will also rediscuss about transplantation. So this whole week is about transplantation. The biggest message is to uh, to bring awareness about what is being done here, and also the biggest one for the public is also the kidney donation safety. So to make them aware that you can donate your kidney and you stay safe, you stay active, you do everything like a normal person who didn't give donation. And studies are being done to elaborate, so it's not like something we are making up. We know that kidney donors live same life than the same like those one who didn't give kidneys. I may say maybe in Rwanda we don't have clear data, but around 3% of the population is estimated to have kidney disease, which is a lot. And worldwide, now it's among the priority of the WHO. So it touches around 850 millions of population, chronic kidney disease. So it's a lot of patients. So it's a very big burden. And we, as I said previously, we want to emphasize on awareness so people get screened and get preventive measures, get the golden rules that I have said previously, so we can prevent them to progress to chronic kidney disease. Because it's when you progress, we have there's a lot of changes, quality of lives deteriorates, costly in treatment, and as the theme of this year is kidney for health, caring people, and protect the planet. So vice versa, it interacts because when you have climate change, some climate change factors can influence on kidney disease, but also some of the treatment of kidney disease can also influence the climate, mainly dialysis. So that's why this year we choose to focus on transplantation, which can be one of the green nephrology. For the followers, if they have more questions, they can ask. We are always here to answer.